So could we have questions for our panel? Preferably not for the chair, but if you must.
Has anyone got any questions?
Yes, please.
Did you raise your hand?
Hi, thanks. There's been an enormous amount of food for thought this morning. And my question's really for all of the panel, including Sir Michael, and it relates to the issue of power, both explicit and implicit. And just really looking for some kind of comments around that, both in relation to justice and equity across social determinants of health, but more relevant to today and to your presentation, Joe, is the issue of power in and with communities, particularly in how they can, how do we actually share power and give power away?
Shall I start? As I was mentioned by name, I feel like perhaps I ought to be the first to respond. Thank you for that. And actually, one of the words that I wrote in bold on my sheet but didn't actually say was empowerment in terms of communities. I think this is really difficult because one of the most difficult ways to engage in communities is that they feel that they haven't got power. And no matter what I say, that is not going to change. So how do we shift the dialogue? How do we shift the dynamic into a story where you will be listened, there is hope, there is something that's going to change as a result of you engaging with this. One of the most powerful experiences I've had actually is doing in lots of parts of my career, public consultations, engaging young people, engaging communities, asking them to share their experiences, which they do so because they really believe that something different is going to happen. And when that something different doesn't happen, you've completely lost them. You've lost them for generations, possibly, actually, depending on your subject matter. So I think it's about authenticity and honesty in engaging with communities, being realistic about what it is that can be achieved, but absolutely working with them and not doing stuff to them to create that power sharing dynamic.
Could I say something?
Sure.
Could I ask in the audience to put your hand up if you stop work for a moment and think about your own life, and raise your hand if in the last 6 months you have been involved in the development, delivery or evaluation of public services in your community. Could you raise your hand if you have? A handful. What I wanted to do that is to demonstrate that this stuff is difficult. We recognise that we want to involve communities and share the power, but it's complex stuff, and we need to do it in a way that's actually interesting for members of the community. If you did an analysis of community councils across Scotland at the moment, I guarantee you the majority of people on there would be white, retired, middle class. We need to do something radically different that gives people ownership and makes this exciting for people, so that we share the power and people have hope.
Other questions?
Hi, I'm Jonathan Shear from Queen's Nursing Institute, Scotland, and I appreciate Sir Michael doing the name check at the very outset. As I've listened, I want to offer a reflection which can then be a question. What I've heard this morning, coming from decades of a background in community development and then shifting to decades of work on public health and maternal and child health, is that there are lots of important pieces of this jigsaw puzzle that have been identified and laid before us today compellingly well, and those are all really important pieces of the puzzle. But there's one that I think is still missing, and that is all of the work about ACEs is predicated on what happens after a child is born. It's after that fact. All the 10 in the original research and now the additions that have been made. And I just want to reflect that adversity that affects children's lives and affects them throughout their lives begins before birth for many children, and begins before conception in many cases. And so if we want to get to the roots of adversity, if we want to do prevention work, it isn't all about the work that happens after children are born, but rather happens before they're born and happens with their parents before they become parents. Because one of the things we know is that it's still true that the best predictor of child outcomes is the health and well-being of the mother at the time of conception. And so what happens during that long period before birth has as much to do with adverse childhood experiences as what happens afterwards. And the thought which, after all these years, had never occurred to me until this morning is that everyone is created equal. And when that's said, it's meant that we all have the same human rights. We all should get the same respect and dignity. But even though we're all created equal, what dawned on me this morning is that we're not all equitably created. And that's what needs to change as one other piece of this important puzzle you've all identified.
Thank you. Other questions or comments? Yeah.
You were talking about the benefits of different departments working together. In Scotland, we're in the situation of having some experience of universal credit being rolled out. We know what the impact of the welfare reforms are, and we know that there are opportunities in Scotland with devolved powers to make some changes. One of the things that has really registered with me, that particularly today, is what people have said about the impact in terms of security. We know that it's a human right to have social security, and often change can take a long time because in terms of legislation, Neil, you were saying it took 18 months to have that conversation in Glasgow. So where different organisations and at government and local government level, people do have powers, and in crisis situations, often things, change can happen quickly, or some of the barriers can be taken away. What do people see as the opportunities just now in terms of welfare reforms where there's a recognised impact? We know the connections between people who have experiences of ACEs who are also experiencing health issues and are also parents as well. So a question, what does it take for change to happen much more quickly in terms of national policy and locally?
So thanks for that question. And I think actually I want to relate it to Fiona's question about power. So change can happen more quickly if power isn't shared, because somebody can make a decision and get on with it. And so I'm not, I think we want to just pause and say, you know, in what circumstances is speed of change the more important thing, and in what circumstances is it really helpful to create a bigger space that more people's voices can be heard and involved in shaping what that change looks like. And I think these two are at tension, and there's going to be times where actually the speed of change is the more important thing, and there's going to be other times where the sharing of the power and having the wider involvement in designing a new system is going to be the more important thing. And as you'll know, for the new social security powers in Scotland, the primary objective has been safe transfer of powers from DWP to Scotland, and just making sure nobody gets missed off in that process, and that, you know, all of the IT systems speak to each other and all of that. And then the second priority has been to design the new system based on the experience of people who are going to be using that system, as well as on the views of the wider public. So I think there has been, for very, very good reasons, a conscious decision not to rush it, but to make sure that we end up with a system in Scotland that's based on what people are saying is really important to users of that system, and to design it in that way. So I don't know if that answers your question, but I think these things are at tension, actually, and we need to find a way through it. I often actually refer to the work on ACEs as being a fantastic example of not rushing to what the solution would be, but actually to taking that approach of involving a wide range of people from across the country, from across different sectors, learning from elsewhere, and actually opening up the options before we kind of narrow down into specific decisions about what should happen. And that seems to me to be the right approach for this, because it is so complex. It involves all the sectors, and it would be too easy to jump to a single solution, I think, in relation to this. So I think actually what's happening here is a good example of taking time and involvement to shape a response to this set of issues in Scotland.
Thank you. I think we should stop. But Carol's point, I think it reflects what we've been hearing this morning, this tension between having people take decisions, and I'm trying not to talk about the mess in Westminster, but the tension on the one hand, you elect your representatives to make decisions on your behalf. That's how representative democracy is supposed to work. On the other hand, disempower the community, and it doesn't work either. And one of the many things that Neil said that I made a note of was we wanted a 10-year program. We didn't think we could change this overnight. We wanted a 10-year program. Very important. A second thing he said this was something that was developed in New Orleans. And then a bit later he said this is something that was developed in the Netherlands. And a bit later he said this is something that was developed at Harvard. Yeah, we share. We learn. We share, we learn from wherever the best models are. Vitally important that we're not insular. But if you bring a model from the Netherlands or New Orleans or Harvard and you go into the benighted ex-shipyard part of Glasgow and say, right, we're going to do this to you guys, forget it. Isn't going to work. So learning from where good things are happening, but then working with the community to make it happen in a way that's meaningful to the community. I mean, I like, sorry, I don't mean to leave you out, Joe, but I like the way Carol said it, the tension between what needs to happen centrally and what needs to happen in terms of community engagement. A few years ago, I was invited up to Liverpool when to talk about my English review, and they had lots of community people. They had breakout groups, and then they reported back. And I was asked to respond to their summary, to what they said. And my summary was, the first thing they said was, we do not want an outside expert telling us what to do. And I looked around and I thought, they're talking about me. And the second thing was, they said that our values should determine our goals, not what some technical expert says should be. And the process was the third thing. The process of getting there is important, as well as the destination. So I listened to this and I said, okay, you think it's more important to do your thing, regardless of whether it works. The important thing is that it's yours rather than it be effective. So now I had 200 Scousers and me having a standoff. And they said, well, okay, tell us the principles of what works, but then let us figure out how to do it. And I think, isn't that what you're saying? Tell us the principles of what works, but let us figure out how to do it. So we learn, we share. I hope people in England will learn from what's happening in Scotland and what's happening in Wales and what's happening out there in the community. And just to reinforce what I said at the beginning of this post-break session, I've quoted in the past what I've learnt in Thailand. The Thais talk about the triangle that moves the mountain. And the triangle, the three parts of the triangle, are government, academia, knowledge, and community. And get the triangle right, and we can move mountains. Thank you.